Hi, I am OPAL Nutrients co-founder Sierra Silverberg, certified nutritionist.
And I'm Dr. Howard Aubert, OPAL Nutrients co-founder and medical director.
So we came on today to talk about a very serious but also a very fun, when you make it fun, topic of women's vaginal health, UTIs, and all thing vaginal flora. So the first thing I kind of want to get into is, you're obviously a urologist, for those that don't know. So let's talk about women's vaginal health. What are some of the main things that we need to focus on?
Well, I have a lot of clients that come in, or a lot of patients that come in, and some of their main concerns revolve around getting recurrent urinary tract infections, having issues with vaginal dryness, and having discomfort during sex, as well as with urinary leakage or incontinence.
So to stop some of those problems, what things can we consume as far as what do we eat, what do we take to kind of stop some of those problems?
So the first things you want to do is you want to make sure that you have a diet that's rich in things that are going to build up the vaginal flora. And things that do that are things that are fermented. You can think of things like kombucha, kimchi, goat's milk, yogurt, kefir. Anything that kind of provides that normal fermentation process will help increase the vaginal flora bacteria that you're looking for.
I think as far as supplementation, what are some of the other things that you would recommend?
Other things that you can do to kind of supplement that, if your diet or your taste doesn't allow you to go in that direction, would be you can supplement with oral probiotics. You want to keep at that rate. You want to keep the probiotic CFU in the 40 billion range, or at least over 30 billion range.
Great. So what about as far as vaginal health, vaginal leakage? What are we kind of looking at there for the average female?
So the first thing we think about is, I want you to think about the anatomy of the pelvis. Let's say we're to cut you right down in the middle. If you think about in the front, there's a bone that you feel right in the front. That's called the pubic bone. If you think in the back, there's another bone back there. That's called the sacrum or the tailbone. And then we think about what's in between those two bones. Well, right behind the pubic bone is a structure called the urethra, and that's attached to the bladder. So the bladder is where the urine's stored, the urethra is where the urine comes out. Right behind the bladder and the urethra is another tubular structure called the vagina, and right behind the vagina is another tubular structure called the rectum. So there's three structures that sit in between those, and they all have important functions. Think further about it, the pelvic floor is made of a lot of different layers of muscle that keep all these things in place. And when you can develop laxity in that muscle, you start to get a lot of problems. That's where you start getting issues with urinary leakage, or you hear some people talk about, oh, my bladder dropped, or my bladder's falling. And so those are all things that have to do with pelvic floor muscle weakness.
So to prevent that from occurring, what things can we do in our daily life, and things can we eat, consume? How do we stop that from occurring?
So one of the main things that you can do is, just like you would exercise any other muscles, you can actually exercise these pelvic floor muscles. The name for that is to do these Kegel exercises. But there's a trick to it. Most people, or 99% of women, do Kegel exercises wrong. How do you do your Kegels?
I just squeeze, I think.
So most people just say, I just squeeze. And when I ask them what they squeeze, it's like, oh, well, I just squeeze my vagina muscles. And I'm like, well, that's okay, but there's actually a science to Kegels. If you think about it, there's a thick band of muscle in the back, there's a smaller band of muscle here, and there's an even smaller band of muscle here. So what you do is you have to work those muscles from back to front. So the first part of doing a Kegel is you want to pretend like you're stopping yourself from passing gas. So you're going to squeeze and work on those posterior muscles first. The second thing you're going to do, the second exercise, the actual squeeze your vagina muscles, like you're trying to hold something in there. And the third exercise is you're trying to squeeze like you're going to try and stop yourself from urinating. And if you really focus on it, those are three very distinct yet very different muscles to work, and three very different exercises. You want to spend about 5 seconds each squeeze, 10 times each exercise. And on average, that's going to take you about 3 minutes a set to do.
So that being said, we've now talked about flora, we've talked about strengthening the muscles. let's talk a little bit about UTIs and UTI prevention.
All right, so UTI prevention. UTIs occur when bacteria from the area gets into the urethra. And the most common place for that bacteria to come from is the rectum. So the rectum is full of stool. And one of the things that we can focus on in preventing urinary tract infections is improving our bowel habits. The most common cause of urinary tract infections tends to be constipation. So imagine this opening is very close to this opening. If there's not a lot of bacteria there, there's not a lot of bacteria that can go there. But if there's a lot of bacteria or a lot of stool in this area, the bacteria can easily get from here to here. So that's a common way for that to happen. And so one would think, well, how can I prevent myself from keeping a lot of stool in that area?
Yeah, and I think that one of the main ways that we can all agree would be cleanse and restore, as well as some of our other OPAL products. So what OPAL products would you recommend to prevent constipation and to help with constipated clients?
So constipation is one of those things we definitely want to get on our probiotics again. Make sure that our bowels are moving consistently and regularly. But we also want to do things like what else can make our GI system work more naturally and more efficiently. And that's going to be using the cleanse and restore. Cleanse and restore is going to make sure that your liver is functioning properly, and it's allowing everything to go down that GI pathway in such a fashion so that it'll eliminate easily, quickly, and without any discomfort.
So our cleanse and restore does come in more than a 30-day supply, depending on how many pills you take on a daily basis. What would you recommend to the average person that's dealing with constipation to take of cleanse and restore?
Most of my patients that have constipation, I tell them in the beginning, this is a chronic problem that you've had for a long time. It's not going to fix itself in a minute. So if you're looking for one of those overnight fixes, one of those super cayenne pepper cleanses, it works really good at cleansing just the bottom part of the rectum out. But your large intestine starts at the rectum, goes up to your left upper rib, across to your right upper rib, and down to your right lower pelvis. So I mean, there's probably about 12 feet of intestine in there. So a quick cleanse is not going to do it. So most of my clients, I tell them, you're going to be working on this for at least 3 to 4 months to get your entire system back regulated in a normal fashion.
So how many pills specifically would you recommend to the average consumer to take a day of cleanse and restore?
Cleanse and restore, they're going to take 2.
Great. I think that gives us a pretty good idea of vaginal health, a little bit about constipation, and primarily all of our vaginal flora that we need to be dealing with on a daily basis. So remember to do your Kegels, and until next time, we'll see you at opalnutrients.com.